Hello and welcome to yet another episode of Sikkim This Week, an initiative of the IPR Department, Government of Sikkim. Today in this episode, we are going to talk extensively about the health reforms brought about by the Government of Sikkim, led by Honorable Chief Minister Sri Prem Singh Tamang. And to talk about Su-Swastha Yojna, we have an illustrious panel comprising of Dr. Gaurav Kumar. He is the medical advisor for Su-Swastha Yojna. He is also a chief consultant. He is a medical practitioner with an experience of over 20 years. Dr. Gaurav has served in reputed private hospitals in the country. He has a wide range of experience of over 20 years and he has treated a lot of patients from Sikkim, both while staying in Sikkim as well as Delhi and Hyderabad. We are joined in the panel today by Mrs. Tishan Tashi. She is the PR and communications lead for Su-Swastha Yojna in Sikkim. Ms. Dichan has been instrumental in taking the message of Su-Swastha Yojna across to different stakeholders in the government, especially the government employees who are the direct beneficiaries of this scheme. I heartily welcome Dr. Gaurav and Ms. Dichan Tashi to this talk show.
Thank you.
So taking the discussion forward, my first question to Dr. Gaurav would be, Sir, the Su-Swastha Yojna is a medical insurance. In plain terms, when you look at a medical insurance, there is a little bit of reluctance in the people about medical insurance. मैले गर्नुपर्ने हो नगर्नुपर्ने हो यो scheme, because it involves money and it involves a certain kind of benefit that you're getting. Whereas this scheme, the Su-Swastha Yojna, which was launched by the Honorable CM and it is the vision of this government, it is seen as a medical insurance with a human touch. How do you see this? How is it different from all the other insurance policies? Sir.
Thank you, Raji, for that question. And first of all, म IPR department र तपाईले धन्यवाद भन्न चाहन्छु for giving us this opportunity to come here and speak about Su-Swastha Yojna. By the end of October or November 2020, Su-Swastha Yojna को complete model prepare भएको थियो. यो साल लकडाउन अलिक रिल्याक्स होनेपछि अप्रिल 2021 मा सुस्वास्थ्य योजनाको फर्मल इनॉग्रेशन बाय द ह्यान्ड्स अफ ऑनरेबल चीफ मिनिस्टर, ऑनरेबल हेल्थ मिनिस्टर has happened on 29th of April. यो योजनाको इम्पोर्टेन्स फर द हेल्थ केयर अफ द बेनिफिशियरीज is very important to understand. हेल्थ केयर इन्स्योरेन्सको मेन जो फाइदा छ, the main value is that your health is the financial expense of your health is taken care of by somebody. Right. This body is normally called as the insurer or the payer. Our Government of Sikkim को insurance हुँदाखेरि the insurer is the Government of Sikkim. मतलब यो insurance मा जति पनि beneficiaries छ, employees of Government of Sikkim or their family members, they do not have to worry about the healthcare expense. Right. That healthcare expense will be taken care of by the Government of Sikkim. You say एकदमै important कुरा छ, because के पनि डिजिज और सिकनेस हुँदाखेरि नि मान्छेको मनमा डिफ्रेन्ट काइन्डको स्ट्रेस र एङ्जाइटी हुन्छ. त्यो टाइममा तपाईले राम्रो हस्पिटल हेर्नु कि राम्रो डक्टर हेर्नु कि हेल्थ केयरको एक्सपेन्सको अरेन्जमेन्ट गर्नु. सो दिस फोकस अन क्यासलेस इन्स्योरेन्स इज भेरी इम्पोर्टेन्ट. Although Su-Swastha Yojna ma cashless एउटा category of insurance छ, there is also the category of insurance called as reimbursement. त्यो पहिलेदेखि जो reimbursement को एउटा system छ health care को expenses को, that system will continue in a little form, but the focus is on cashless insurance. Now the main value of this cashless insurance is that any beneficiary, for example any emergency medical disease or need of surgery or even for daycare procedures or things like dialysis or dental procedures or cataract surgery, any of these things, यो cashless basis मा हुन्छ. कहाँ हुन्छ? इन्डियाको टप 400 हस्पिटल्समा. सो सुस्वास्थ्य योजनाको एउटा प्यानल अफ हस्पिटल्स छ. त्यो प्यानल अफ हस्पिटल्समा अहिले आजको डेटमा हेर्नुभयो त्यो about 300 हस्पिटल्स आर इम्प्यानल्ड विथ सुस्वास्थ्य योजना, लाइक हस्पिटल्स लाइक मेदान्ता हस्पिटल जो चाहिँ इन्डियाको नम्बर 1 प्राइभेट हस्पिटल छ, और अपोलो हस्पिटल और फोर्टिस हस्पिटल, मैक्स हस्पिटल, केयर हस्पिटल, even Siliguri, which is the nearest medical destination for us, Anandok Hospital, Medica, North Bengal, Neotia, यो सबै हस्पिटल्स सुस्वास्थ्य योजनामा फर क्यासलेस केयर इम्प्यानल्ड छ. मतलब क्यासलेस केयर इम्प्यानल्ड छ मतलब तपाईले चाहिँ के गर्नुपर्छ क्यासलेस केयर अवेल गर्दाखेरि सुस्वास्थ्य योजनामा एनरोल तपाईँले चाहिँ एम्प्लोइ र एम्प्लोइको फ्यामिलीले सुस्वास्थ्य योजनामा एनरोल गरिदिएपछि तपाईँले एउटा स्मार्ट कार्ड पाउँछ। त्यो सुस्वास्थ्य योजनाको गभर्नमेन्टको इस्युड मेम्बरसिप कार्ड हुन्छ। All you need is that smart card. All you need is that Su-Swastha membership card. Suppose there is a medical emergency with me, I am an employee and there is a medical emergency in my family, or there is a need of a planned treatment like a total knee replacement or anything else. All you have to do is, Su-Swastha Yojna ko hamro jo website छ नि www.suswasthasikkim.com त्यो वेबसाइट मा गएर एउटा लिस्ट अफ हस्पिटल्स छ, फाइन्ड अ हस्पिटल ट्याब छ। त्यो ट्याबमा चाहिँ क्लिक गरेपछि तपाईले चाहिँ सबै हस्पिटल्सको कन्ट्याक्ट डिटेल्स, हस्पिटल्सको इम्प्यानल हस्पिटल्सको लिस्ट र एउटा हेल्पलाइनको नम्बर त्यो सबै पाइहाल्छ एन्ड द वेबसाइट अफ द हस्पिटल। त्यो हेल्पलाइनको नम्बर हाम्रो नम्बर छ, सुस्वास्थ्य योजनाको नम्बर छ। हाम्रो एम्प्लोइजले त्यो नम्बर 24/7 म्यान गर्छ। त्यो नम्बरमा तपाईले फोन गर्नुभयो त हामीले चाहिँ फेसिलिटेट गरिदिन्छ इन द सेन्स कि हाम्रो एउटा एम्प्लोइ छ, एम्प्लोइको फ्यामिलीमा यस्तो सर्जरीको जरुरत छ, एम्प्लोइ अहिले दिल्ली जाँदैछ अपोलो हस्पिटल, मेदान्ता हस्पिटलमा ट्रिटमेन्टको लागि। त्यो हस्पिटलमा अपोलो हस्पिटल्समा जो इन्स्योरेन्स डेस्कको एम्प्लोइज हुन्छ र डक्टर्सको टिममा सेक्रेटरी, कोअर्डिनेटर, इभन डक्टर हुन्छ। सो बिफोर यु रिच द हस्पिटल वी टक टु देम, वी एक्सप्लेन द रिक्वायरमेन्ट्स, वी एक्सप्लेन बोथ द मेडिकल नीड्स and the non-medical needs like travel, stay and all those things. Basically what Su-Swastha Yojna does is it provides you a sort of a guardian or an assistant.
Right.
You know, you can call us both.
Right.
We take care that medical quality of treatment is good. The government of Sikkim takes care that you don't have to go through arrangement of funds for any kind of surgical or medical treatment, even if it is an emergency. And the biggest improvement I feel is that पहिलाको सिस्टममा चाहिँ एउटा हामीले चाहिँ रेफरल एन्ड रिइम्बर्समेन्टको सिस्टम भन्दाखेरि त्यो सिस्टममा चाहिँ डकुमेन्टेसनको एउटा प्रोसेस थियो। अब एज टाइम has gone by, people have moved from paper based documentation to digital documentation. त्यो टेक्नोलोजी एउटा एकदमै इम्पोर्टेन्ट इनेबलर छ आजको दुनियाँमा प्रोसेस छिटो गर्नलाई। अब पहिलाको सिस्टममा चाहिँ रेफरल एन्ड रिइम्बर्समेन्ट, मेडिकल एसेन्शियालिटी सर्टिफिकेट, रेफरल लेटर, यो सबै कुरा थियो। To improve that process because of the need of patients and their families. अब Honorable CM sir को working committee को जो vision छ त्यो कस्तो छ, fast healthcare, good quality healthcare and economy of healthcare. मतलब पैसाको टेन्सन हुँदैन, राम्रो हस्पिटल, राम्रो डक्टरको टेन्सन हुँदैन, कति टाइम लाग्छ यो प्रोसेसमा त्यो टेन्सन पनि हुँदैन। सो डिजिटल प्रोसेसेस मतलब एनरोलमेन्ट पनि डिजिटल छ, arrangement of hospital, doctors, stay, medical facilities is also digitally done. And after you come back, suppose you have taken a cashless system, then Government of Sikkim, what is your payment huncha hospital ko, that system is also electronic. Suppose you have opted for a non-cashless treatment, त्यो option पनि छ Su-Swastha Yojna मा। Suppose you opt for a non-cashless treatment and you want to reimburse, कहिले हुन्छ suppose the medical treatment को खर्च चाहिँ कम्ती छ, suppose 30-40,000 को सर्जरी छ, तपाईले यस्तो भने कि हैन इन्स्योरेन्स म राख्छु, फर एनी ठुलो मेडिकल निड भयो त म इन्स्योरेन्सको पैसा चाहिँ युज गर्छु, अहिले यो सानो सर्जरी छ यसको लागि म आफ्नो पैसा तिर्छु। त्यो भन्दाखेरि तपाईले त्यो पैसा पेमेन्ट गरेर रिइम्बर्समेन्टको प्रोसेस पनि चलाउनुहुन्छ, बट द्याट रिइम्बर्समेन्टको प्रोसेस इज भेरी डिफरेन्ट फ्रम पहिलाको रिइम्बर्समेन्ट प्रोसेस इन द सेन्स इलेक्ट्रोनिक सिस्टम छ। तपाईले चाहिँ हस्पिटलको बिल स्क्यान गरेर वेबसाइटमा अपलोड गर्नुहोस्, विदिन 3 days अप्रुभ भइहाल्छ एन्ड गभर्नमेन्टको यस्तो कमिटमेन्ट छ द्याट विदिन 2 weeks द पेमेन्ट्स विल बी डन बोथ टु द हस्पिटल्स एन्ड द। अब यो सबै प्रोसेस अहिले हुँदैछ। सो अल द सिस्टम्स आर इन प्लेस, technology enablers are in place and people are being trained, for which Dichen and her team is going to each department of Government of Sikkim, and we keep getting, there is a very important part of that which is the nodal officers of the Government of Sikkim. We are taking the benefits of Su-Swastha Yojna to all the departments, all the employees of that department, and because the process is digital, so employees and nodal officers, they can access the portal which is on our website and they can quickly enroll themselves with very minimum discomfort. And आजकल को कोविड को टाइम में to personally travel to some place, meet people over there, hand over your paper based applications and all these things, there is a risk of pandemic also and it is inconvenient also, it is slow also. So यो सबै कुरा चाहिँ फोकसमा राखेर यो सबै कुरा डिस्कस गरेर ओभर द लास्ट 1 year एउटा राम्रो मोडल क्रिएट गरेर सुस्वास्थ्य योजनाको इनोग्रेसन भएको छ। एन्ड इन माई ओपिनियन And if you compare all the benefits of other state government insurances or the central government insurance scheme, this is simply the best insurance. A cashless scheme हो 20 lakhs को coverage. 20 lakhs को medical coverage मतलब 99.99% medical or surgical procedures will be covered under the scheme. तो 20 lakhs को coverage में 10 lakhs को coverage is for base health care. Suppose you need a total knee replacement, or you need a CABG cardiac bypass, or you need a delivery, or you need treatment for infertility, something like that, or an endoscopy or something like that, appendix, gallbladder removal. But suppose you have got a bigger problem. Suppose you are admitted in the ICU, or suppose you need a transplant surgery. That expense has been so nicely built in Su-Swastha Yojna that okay, 10 lakh को coverage से basic problems को लगी छ, which will itself cover 80% of diseases. But suppose you need more coverage than that because of critical care, ICU care, or transplant, or sometimes accidents and trauma ma bill 10 lakh को माथि जान्छ. At that time there is another clause of additional 10 lakhs of coverage. यो 20 lakhs को coverage India ma no other state or central government scheme has got a 20 lakhs of coverage. That makes Su-Swastha Yojna the number one beneficial scheme of healthcare insurance for the state of Sikkim beneficiaries, and that's the reason why, because I believe that it's a transformative healthcare initiative at the national level, not only at the state level. And therefore, it's my appeal to all the government departments to encourage the employees who are eligible for this Yojna to as soon as possible get enrolled in this scheme. And छिटो भन्दा छिटो enroll गरेर आफ्नो family members लाई enroll गरेर यो योजनाको चाहिँ लाभ उठाउनुहोस्.
That was a very comprehensive information from you, Doctor. So basically, when you look at the background of this scheme, we can say that I think now with this scheme there will be a lot of equality. पहिला के हुन्थ्यो भने मान्छेले फाइल चलाउनु पर्थ्यो रिइम्बर्समेन्टको लागि, and reimbursement, not only reimbursement but even for referrals. Basically, I think is this scheme doing away with the system of referrals? What do you think?
एकदमै तपाईले ठीक भन्नुभयो राजी. यो स्किम चाहिँ पहिलाको रेफरल एन्ड रिइम्बर्समेन्ट सिस्टमलाई चाहिँ कम्प्लिटली रिप्लेस गर्दैछ. ओन्ली एक्सेप्सन इज कि पहिलाको सिस्टममा नि ओपीडी को जो ट्रिटमेन्ट छ नि, ओपीडी को ट्रिटमेन्ट मतलब ओपीडी को दबाई वगैरह हुन्छ नि, त्यो वन्स यु हेभ कम ब्याक एन्ड यु आर suppose diabetes or blood pressure or any other thing, there are many diseases in which you take continued medicines for lifelong. त्यो OPD को medicines को bills छ नि, त्यो चाहिँ old system बाटै reimbursement हुन्छ OPD को लागि. यो सुस्वास्थ्य योजना यो साल 2021 मा यो inpatient care or indoor patient care जसमा चाहिँ एडमिट भएर हस्पिटलमा ट्रिटमेन्ट गर्नुपर्छ, फेरि डिस्चार्ज हुन्छ, त्यो हस्पिटलाइजेसन क्याटेगोरीको लागि छ. र डे केयर सर्जरीज और डे केयर प्रोसिजर्सको लागि छ. अब डे केयरमा चाहिँ के आउँछ, नर्मली डेन्टल ट्रिटमेन्ट भयो, क्याटराक्ट सर्जरी भयो, डायलिसिस भयो, किमोथेरापी भयो, यो सबै कुरा चाहिँ डे केयरमा आउँछ. तो यो डे केयर सर्जरीजको लिस्ट र के ट्रिटमेन्ट्स कभर्ड छ सुस्वास्थ्य योजनामा, यो तपाईले नि हाम्रो वेबसाइट www.suswasthasikkim.com मा गएर वेबसाइटको एकदम बटममा नि क्विक लिंक्स हुन्छ नि, त्यो क्विक लिंक्समा सुस्वास्थ्य योजनाको पोलिसी डकुमेन्ट छ. त्यो पोलिसी डकुमेन्टमा क्लिक गर्दैपछि त्यो पोलिसी डकुमेन्ट तपाईको मसिनमा चाहिँ कम्प्युटरमा डाउनलोड भइहाल्छ. इट्स अ 25 पेजेसको डकुमेन्ट छ. त्यो डकुमेन्टमा चाहिँ एकदम डिटेलमा चाहिँ के छ इन्क्लुजन्स और एक्सक्लुजन्स मेन्सन हो. यो साल 2021 मा सबै इन्डोर ट्रिटमेन्ट्स, हस्पिटलाइजेसन्स, डे केयर सर्जरीज, these are included. Now the government of Sikkim is considering that next year onwards other treatments like outdoor patient treatment or wellness packages, they might also get included in this. That all depends on the success and enthusiasm of the beneficiaries. And that's also a reason why if you want to avail more and more benefits of this scheme in the future also, it is very important that सबैजनाले enroll गरेर यो scheme लाई चाहिँ successful गर्नुपर्छ. And
so now अब हाम्रो भ्युअर्सलाई अब अहिले उत्सुकता भइरहेको होला कि यसमा बेनिफिट के छ, बेनिफिशियरीले के पाउँछ, किनभने अब फाइदाकै सौदा हुनु पर्यो हैन त. अब when you are doing an insurance policy फाइदा हुनु पर्यो. So I'm going to come to you, Ms. Dichin. Could you kindly tell us about the beneficiaries who are going to benefit from this? What are the criteria? यो चीज चाहिँ तपाईले kindly बताइदिनु.
Of course. Since this is just the phase 1 of our initiative, right now a government employee would be a regular government employee under the state of Government of Sikkim, and also include central government employees and government employees from other states who are here in Sikkim, in the Government of Sikkim, under deputation.
Okay.
Right? So, as Dr. Gaurav mentioned, the whole list of benefits from our scheme. So, the main list of from the list of benefits, the main benefit would be that it is a cashless system, right? So that means that you can, with our smart card, you can go to any hospital empaneled under us, and then you can avail of their treatments.
Okay.
So out there, once you show a smart card, that means you will not have to pay any cash. Everything will be directly cleared by the government of Sikkim.
तपाईले त्यो ट्रिटमेन्ट गर्न जाँदाखेरि चाहिँ हेल्थ डिपार्टमेन्टलाई भनिरहनु परेन कि म ट्रिटमेन्ट गर्न जाँदैछु भनेर त्यस्तो केही भन्नु परेन but somebody will be monitoring that.
You just a simple phone call
Okay.
to the Su-Swastha team
Okay.
on a helpline number. You can just inform them, and then once you reach the hospital and Su-Swastha team will arrange for everything,
Okay.
so that the process is very smooth. From your end,
Correct.
you will not
So
have.
they can also call your office, which is there in STNM.
So, Raji, यस्तो छ कि सुस्वास्थ्य योजनामा नि एउटा very important clause with the agreement with hospitals is that every hospital has to designate
Okay.
a Su-Swastha Yojna coordinator.
Okay.
So, अब सपोज तपाईँले मेदान्ता हस्पिटलमा जानुभयो है, मेदान्ता हस्पिटल इन्डियाको सबैसे ठुलो प्राइभेट हस्पिटल छ. It's a huge hospital, almost 1300 beds, and it's considered to be the number one private hospital in India. It's like that's why they call it Medicity. It's like a city in itself. Even for somebody who has gone to large hospitals to take medical care, it is very easy to get confused with the lot of processes over there. Your time, money, एउटा चाहिँ personal attention, एउटा personal coordination गर्ने एउटा मान्छे चाहिन्छ.
Okay.
अब मेदान्ता हस्पिटलको example दिन चाहन्छु. मेदान्ता hospital has very kindly given a person who was actually born and raised in Sikkim only, but is working in Medanta Hospital now. He has been designated as a Su-Swastha person from the hospital side. Now, similarly, other hospitals also.
So is there a dedicated help desk or something, or
there is
just one
yes.
person?
As you enter the hospital, there will be a designated area for insurances. In those insurances help desk, there is a designated help desk for Su-Swastha Yojna.
For
Now, for Su-Swastha Yojna Sikkim.
all the
empaneled hospitals, and they are supposed to prominently display that board also, and our team will actually go and audit all these hospitals whether the system on the ground of helping people from Sikkim is existing or not.
Okay.
Now, in some hospitals, no, it is India, a diverse country, every state has got its own language. Sometimes down south when you go, you can get confused with the difference of language. Even there might be accents in different part of the country, and it is difficult to overcome those cultural challenges. उसको लागि हामीले चाहिँ यस्तो try गर्दैछ that even in hospitals which are in the southern part of the country, we have got people who are speaking the local language, so that people from Sikkim, when they go over there, there is no cultural barrier, And all these things are basically they underline the focus on healthcare with a human touch. That human touch is very important. For example, तपाईले यस्तो भन्नुभयो that what does an employee have to do in order to avail benefits? अब एकदमै सिम्पल छ. एम्प्लोयीले चाहिँ हस्पिटलमा प्लान गरे, अब नेक्स्ट मन्थ अब सुस्वास्थ्यका थ्रु हामीले चाहिँ मेडिसिन टेलिमेडिसिन कन्सल्टेसन्स वगैरह पनि फेसिलिटेट गर्छ एज अ भ्याल्यू एडेड सर्भिस फर द बेनिफिट अफ आवर पेसेन्ट्स. सपोज तपाईँले डक्टरको साथमा फोनमा बात गरे or टेलिमेडिसिन कन्सल्टेसन गरे, अब नेक्स्ट मन्थ 15th August, suppose you are traveling to Delhi. At that time, you don't have to do anything. I mean, you can travel independently also. All you need is the card, Su-Swastha card. But suppose you call the Su-Swastha team, 98003-47944 हाम्रो नम्बर हो. यो नम्बरमा चाहिँ तपाईले कल गरे or WhatsApp गरे that I want to go to this hospital. Even on the website also there is a form which you can fill. त्यो फर्ममा चाहिँ तपाईले which hospital is your choosing. अब पहिलाको भन्दा this difference is also important. पहिला नि रेफरल र रिइम्बर्समेन्ट को प्रोसेसमा यस्तो प्रोसेस यस्तो थियो that you will get a medical essentiality certificate and you will get a referral letter and there will be a particular hospital written in that referral letter, हैन. Now that is not the constraint. That condition छैन. Choice is with you. It's your health, it is your choice. You have the membership card of Su-Swastha, and with the membership card of the Su-Swastha, if you go to the website, you say, okay, I need suppose my father needs a heart surgery. He is a dependent on me. I am a Su-Swastha member beneficiary. I decide, okay, heart surgery को लागि म मेदान्तको डक्टरले पनि देखाउँछु, एस्कॉट्सको डक्टरले पनि देखाउँछु, नारायणको डक्टरले पनि देखाउँछु र अपोलोमा पनि कन्सल्टेसन गर्छु. हुन्छ. तपाईँले चाहिँ 3-4 वटा कन्सल्टेसन गरे. सपोज यु लाइक Narayana, which is in Bangalore. Now it is a long distance. Culture is also different. At that time, all you have to do is you just click on that form and submit that I want to go to Narayana Hospital on 15th of July and for this surgery. Our team will coordinate. हाम्रो टिम तपाईँले कल गर्छ, मेडिकल सर्टिफिकेट्स वगैरह हेर्छ, वहाँको डक्टरको साथमा फोनमा बात गर्छ, फेरि वहाँको डक्टरको साथमा टेलिमेडिसिन कन्सल्टेसन गर्छ, तपाईँको ट्राभल डेट वगैरह फिक्स गर्छ, तपाईँले चाहिँ कसरी कन्भिनियन्स होस् वाइल ट्राभलिङ, वाइल स्टेइङ. सो हाम्रो टिमले हस्पिटलको साथमा बात गरेर, बिकज दे वर स्टेइङ इन अ होटल, इट वाज एक्सपेन्सिभ, एभ्री डे दे वर पेइङ अबाउट 4-5,000 रुपिज ओन्ली फर द होटल. सो हस्पिटलको साथमा बात गरेर हस्पिटलको एउटा 5 मिनट्स वकिङ डिस्टेन्समा एउटा सोसाइटीमा चाहिँ अपार्टमेन्ट लिएर, 2 बेडरुमको अपार्टमेन्ट लिएर, नाउ दि पेसेन्ट एन्ड दि डटर अफ द पेसेन्ट आर स्टेइङ देयर. They are cooking their own meals, they are staying in an apartment, they are comfortable and they are waiting for. So these are the value added services that you get when you coordinate through the Su-Swastha team.
Right.
But you don't have to. Su-Swastha card तपाईको हातमा छ, तपाईको मोबाइलमा Su-Swastha card को photo is also valid. You don't need to carry the physical card, even photo is fine. मोबाइलमा चाहिँ photo हुनुपर्छ. And you can go to any of these 400 hospitals and take benefit there.
So this looks like यो यसलाई यसो हेर्दाखेरि चाहिँ यो एउटा पर्सनलाइज्ड हेल्थ केयर, मतलब गभर्मेन्टले चाहिँ प्रत्येक इम्प्लोइको हेल्थलाई चाहिँ उहाँहरूले निहालिरहेको जस्तो बुझिन्छ होइन.
एब्सोल्युटली.
म्याम, कमिङ ब्याक टु यु, जस्तै तपाईँले भन्नुभयो फर्स्टमा अब गभर्मेन्ट इम्प्लोइ, अब गभर्मेन्ट इम्प्लोइमा चाहिँ अब कस्तो कस्तो
Right, so under the employees, an employee can add himself or herself, and inclusive of that, they can add up to 5 dependent family members. Now I'll outline to you what that means. As a family member, he or she can be a parent. So it has to be a biological or a legal parent of the employee. And then the second is his or her own children. So it can be a biological or legally adopted child. Now in the case of children, they have to be unemployed or and unmarried. So for an unemployed, unmarried son, the age limit is up to 30 years age. An unemployed, unmarried daughter can be of any age.
Okay.
Any age. And if you have any kids, children, just so, who have any sort of certified mental or physical disability, they will also be included under the scheme, and they can be of any age.
Any age.
Any age. And then the third, under the beneficiaries, dependents, can be their own siblings. So if you have a sister or a brother, a biological sister or brother or a legal sister or brother who is of any age, they are also covered. And also your own spouse, a legally wedded spouse. So it can be a spouse of yours who maybe you're separated with but not legally divorced, they can also be covered. And in addition to that, the spouse's parents, their own mother-in-law, father-in-law, they will also in-laws, yes, in-laws, just the parents though.
Okay.
Not the sister-in-law, brother-in-law, but the mother-in-law and father-in-law, they are also covered under the scheme. So these are the list of beneficiaries that are covered. And talking more about the benefits you had talked about earlier, another major benefit is in Su-Swastha Yojna, what we've considered is we've also given importance to women's health. Right. I think it's very important because special treatments like now you see more and more patients undergoing IVF treatment.
Right.
And so for under our scheme, we get a coverage of up to 2 lakhs for IVF treatment. And also women who have who undergo childbirth, we cover both natural birth and cesarean, and we have a coverage up to 50,000 for that. And also neonatal care. So a newborn child is covered from day 1 of enrollment, which is also very unique. And adding to that, other benefits include daycare procedures also that are covered under the scheme. That
so you need not be admitted.
You need not be admitted.
When you walk in with a thing, if you are staying outside and if you just walk in and then you.
For those daycare procedures like chemotherapy, dialysis, which a lot of us people in the hills need, that's also covered. angiography,
Yeah.
radiotherapy,
Maybe eye treatment.
eye treatment also.
Dental.
Dental, as long as it's not for cosmetic purpose.
Okay.
If it's
Surgery,
related
if it
to
is-
if it's related to a medical need that addresses a medical concern that hampers your day-to-day functioning, that is covered. So,
I was reading about this scheme, and one thing that really struck me was the coverage is up to 100 years. एउटा व्यक्ति 100 वर्ष पुगुन्जेलसम्म
for parents, yes.
for parents.
For parents.
यो यही स्किममा मात्रै छ कि
यो
अरू
स्किम
अरू
मात्रै छ. If you look at private insurance or government insurance, there is no other insurance scheme in India, Raji, which will give you children up to 30 years of age and senior citizens up to 100 years of age. Normally, say age 21 years huncha for children and up to 80 years for parents and in-laws. Most of the insurances don't cover in-laws also. So, यो scheme को नि जो benefit को angle छ नि, that government को focus on creating benefit for the members.
Right.
That is underlined by some of these decisions,
Right.
which I have not seen in any other insurance.
I was seeing another important thing. कुनै एउटा पेसेन्टले ट्रिटमेन्ट गरिसकेर आई थिङ्क पोस्ट उहाँको जुन रिकभरी स्टेज छ, जस्तै नानीले एउटा ठुलो सर्जरी भएर 1 महिना जस्तो उहाँले सपोज इफ इज रेस्टिङ अर सो द्याट इज अल्सो कभर्ड.
That is also
मैले
covered.
सुनेको थिएँ.
Yes.
Post-hospitalization procedures.
Right. So what is this?
After 30 days after discharge of a patient from a hospital, any medicines or follow-up treatments and tests, those are also covered within 30 days
Okay.
from the date of.
It has to be in the same hospital or it can be somewhere else?
It has to be in the same.
Same
Normally, it is in the same
Normally.
hospital.
And in addition to that, since we're talking about these hidden costs that go into medical treatments, ambulance transport is also included in
Okay,
this scheme.
okay.
So up to 3 times in a year you can use ambulance
Okay.
transport, and also ICU beds and non-ICU beds also. We have coverage of that also.
Okay.
And what is also unique about this scheme, unlike other health schemes, is there's no waiting period at all.
Okay.
So once you enroll, you can start claiming your benefits also.
So my last question to you is, अब यो अब 200 रुपीस पर पर्सन होइन सर, 200 रुपीस. सो म्याक्सिमम एउटा अब 5 plus 1
5 plus 1.
होइन, मतलब सो म्याक्सिमम इट इज
1200,
राइट. सो 1200मा per month, 1200 per month,
Yes.
and every year you have to sort of renew.
So, if you see the other public insurances of India, it's a very important thing because the emphasis on minimum strain on an employee while providing maximum benefit. That is the mission of Su-Swastha Yojna. Now, if you look at other schemes of India, right from central government health scheme or any other state, Telangana, Maharashtra, Uttar Pradesh, Uttarakhand, if you look at the employee health, ultimately Su-Swastha Yojna cha ke ho euta employees health services scheme. It's a medical insurance for the employees and their families. First of all, Su-Swastha Yojna ko coverage amounts chha ni. So say compared to any other state insurance, it is double.
Okay.
The employee contribution chha ni, it is less than half.
Okay.
If you look at any other state insurance in India, the minimum that you will probably get, to the best of my knowledge, is 760 rupees.
Right.
Normally, it is between 1,000 and 1,200 rupees per person per month. Su-Swastha Yojna ko 200 rupees. 200 rupees per person per month is the employee contribution, which makes it the minimum employee contribution across any state-run health insurance in India. A private insurance ko sath mein to comparison is haina. Private insurance ko thousands ma jana. So it is the minimum employee contribution, but the maximum benefit. And as Deshan Tashi explained, it includes everything except for cosmetic surgery. That is the thing. Chemotherapy, cancer, transplant surgery, heart surgery, trauma, accidents, ambulance, IVF. You talk about it. If it is medically needed, it is covered in Su-Swastha Yojna. The only thing which is not covered is if it is a cosmetic surgery. That is the only part which is not covered.
Right.
Daycare is also covered. And top tier hospitals of India are covered. Maximum coverage is for the medical destinations which are popular for our patients. For example, Calcutta, Siliguri, Delhi, CMC Vellore, Narayana. Those are some of the hospitals empaneled with Su-Swastha Yojna are very unique because they are still probably not popular in Sikkim, but they are the number one in India, sometimes even in Asia. तपाईले याद हुनुपर्छ which hospital is the best for this, because treatment cost is more or less the same across private hospitals in India. You take any of the top 10 hospitals, there is a little difference, 5%, 10% difference. Now, when you empanel in Su-Swastha Yojna as a hospital, there is an inbuilt discounts also which are provided through Su-Swastha Yojna. अब state को initiative, government को initiative को लागि normally hospitals will give you discount. 10, 15%, 20% discount in cashless care is normal, routine. So, once you are aware which is the best hospital, अब हाम्रो यहाँ certain diseases are very common. For example, GI diseases are quite common. Diabetes, heart disease are quite common. Diabetes, heart disease, gastrointestinal disease को लागि चाहिँ normally हामीलाई knowledge हुन्छ. हामीलाई चाहिँ AIG hospital जानुपर्छ, or मेदान्ता जानुपर्छ, or अपोलो जानुपर्छ. But for some of these rare diseases, for that the information and knowledge is now available with our team, and we are able to provide that, and we are able to facilitate that care for the next step.
त दर्शकवृन्द, हामीले सुस्वास्थ्य योजना बारे धेरै जानकारी हाम्रा एक्सपर्टबाट सुन्यौं। हुन त धेरै इन्फर्मेसन अझै पनि हामीले पाउनुपर्ने छ, किनकि समयको पाबन्दीले गर्दाखेरि आज हाम्रो डिस्कसन यही नै राख्नेछौँ। यहाँहरूलाई www.suswasthasikkim.com मा गएर अझै डिटेलमा यो स्किम बारे तपाईहरुले जानकारी लिन सक्नुहुनेछ। उहाँहरुको अफिस ओल्ड एसएनएम को फर्स्ट फ्लोरमा उपस्थित छ र त्यहाँ गएर पनि तपाईले फिजिकली गएर पनि कतिवटा इन्फर्मेसन लिन सक्नुहुनेछ। र हाम्रो गभर्नमेन्ट अफ सिक्किम पेजमा यो भिडियो हामी अपलोड गर्नेछौँ र त्यसमा पनि तपाईले कमेन्ट बक्समा तपाईले केही पनि तपाईको क्वेशन्स क्वेरीज छ भने तपाईले त्यहाँ लेख्न सक्नुहुनेछ। र यति भन्दै डाक्टर गौरव, मिस दिक्षित, यहाँहरूलाई धेरै धेरै धन्यवाद हाम्रो यो शोमा आइदिनु भएकोमा। र हामी सिक्किममा भइरहेको हेल्थ सेक्टरमा पर्टिकुलरली यति बेसी काम भइरहेको छ। देयर इज इनफ्याक्ट अ लट अफ रिफर्म्स द्याट इज बिङ ह्यापनिङ। यो चिजलाई लिएर अझै अरू टपिक्सहरूमा हामी धेरै, आज त हामीले सुस्वास्थ्यमा मात्रै बात गऱ्यौँ, तर अझै धेरै टपिक्सहरू गभर्मेन्टले गरिरहेका इनिसिएटिभ्सहरू बारे हामी धेरै जानकारी तपाईहरुलाई दिलाउनेछौँ। आउने दिनहरूमा हेर्दै गर्नुहोला गभर्नमेन्ट अफ सिक्किम पेज र सिक्किम दिस विकको यो टिमलाई बिदा दिनुहोस्। धन्यवाद।